Welcome, everyone. Welcome to Hamstrings Unlocked, the 21 days where we will devote to improving our homeostasis of this important group of muscles, flexibility and strength. I'll tell you about people that I thought about when preparing this course. The first group of people that I thought about are people who try to stretch their hamstrings for a very long time with questionable success. And especially those of us who are a little bit ambitious and want results fast and try to stretch aggressively and pushing and even getting changes with our body image, how we think of ourselves from perspective of tight hamstrings. I can tell you about hundreds, if not thousands of clients that I've seen over the years who tend to have this kind of expression, I hate my hamstrings, I can't stand it, they're so tight, aren't they tight? Kind of looking for almost a confirmation from me how tight, how ropey and steel rope-like sensation there is. So obviously, just stretching without changing body image is not enough. That's why often we fail by trying to just biomechanically elongate them. So that's a one group of people. Second group of people is a group of people who are already over flexible. All the people who have propensity for laxity. And some research showed that 80% of hypermobile people, people who have too much movement, 80% of them complain of feeling stiffer than average. So how would you treat these people? They try to stretch even more? No, not a good idea. We need to also work on the body image from perspective of detecting the difference between fatigue, discomfort, because so often these muscles are overly contracted. That's why they feel stiff. They're not short, they're too long, but because of their working so hard, they feel stiff, and the person subjectively feels, I'm stiffer than the rest of the world, I need to stretch more. So this is the second group of people that I was thinking. Another group of people are people who do have injuries of hamstrings, people who have pulls, strains of hamstrings, people who have very degrees of tears. And many athletes are plagued by hamstring tears, and those tears can be minimum or even not present on studies, but heal very fast. And some are tears that require months and months, if not years of rehabilitation. So we will cover that group too. And the fourth group of people that I was thinking about when preparing this course are people who have hamstring troubles and they don't even know about it. And for example, people who struggle with sitting posture. Often the reason why we cannot sit so nicely and upright is because the hamstrings are short and they're pulling on the pelvis. People who are tired in standing, who don't appreciate nice skeletal upright posture. Often hamstring imperfections can cause that difficulty. People with low back pain, I would say probably 80%, if not, lower back pains have something to do with stiffness of the hips, namely, in particular, shortness and stiffness of hamstrings. People with hip troubles, people with knee pathologies, so many knee injuries happen because of dysfunctional or not functioning properly hamstring muscles. So these are the groups that I was thinking about, and I'm so happy you're here. We'll have 21 days to gradually, in an intelligent way, to work progressively with our hamstrings. I usually like to start with clarity of theory. So bear with me. We're going to look at some theory. but it won't be too heavy and you don't have to take notes. You will have the recording of the presentation, PowerPoint presentation. For now, just sit and watch the PowerPoint presentation. Yeah, so these are the groups of people that I mentioned a moment ago, people with problems. For example, here, when you see many athletes, especially girls, adolescent girls performing sports, so many of them have troubles with ACL, meaning anterior cruciate ligament tears. And one of the problems is the landing pattern. If you land too upright, you're putting really a lot of strain on this ligament inside the knee joint. Landing more forward creates more strength and power from the hamstring muscles and unloads the ligaments of the knee. But we will discuss why hamstrings, what it means to have beautifully aligned, straight, neutral hip, and how hamstrings, if you look at the corner on the right side here, there's a diagram showing how hamstrings control forward lean of the body. In other words, every time you wash your hands and you lean forward, every time you vacuum and lean forward a little bit, or set a table for a beautiful dinner and you lean forward a bit, how you lean will determine which muscles you're using. Sometimes we get sloppy and we kind of buckle to the side, or we hyperextend our knees. Hamstring muscles play important role in leaning forward, in controlling that forward lean of the body. So all these activities, whenever we open the dishwasher and load it, or put this toilet seat down or up, you're using your hamstring muscles, or you could be using your hamstring muscles. And when we don't use them properly, we tend to overload different structures like our lower back. So let's look at anatomy of our hamstrings. Let's take a look of where the hamstrings are. So this is a side view where we remove all other muscles, but kept hamstrings and calf muscles. If we look in the back, you have this trio of muscles: muscle on the outside, muscle in the center, and inside. So 3 muscles that constitute your hamstring. The biceps on the outside, actually it has 2 heads. If we zoom in, we will see that one of the hamstring muscles is long, that passes to joint. If you follow my cursor from outside below the knee, passes the knee joint, goes up and up and up, and attaches on the seat bone. And then there is a short head of the same muscle that is not going above the hip joint, but originates on the outside thigh bone, femur, and connects with the other bicep. So it's a bicep, short head and long head. On the inside, you have semimembranosus, semitendinosus, and semimembranosus, 2 muscles. So look how one of movements that hamstrings muscles create is bending of the knee. And you picture that when that muscle contracts, it pulls the bones of your lower leg, and your foot can kick back, or you're bending your knee basically. Anytime you bend your knee, it's likely that hamstring muscles are changing their length. They get shorter and they get longer. So here I'm highlighting the bicep muscle. Let's see if I can highlight the semitendinosus muscle. And then on the inside, semimembranosus muscle. So for a moment, let's stop here, and let's touch our own muscles. So as you're sitting, come to the front edge of the seat. So a lot of your thigh is exposed. If you're sitting on the floor, you can do it with your knee bent, with the knee to the ceiling. And go ahead and start to touch with your hands underneath your right thigh. Listen to the sensation of the back of the thigh. And feel, maybe I'll put the screen back up so you'll be able to see it, what you're touching. And we'll pause. And let's go to the outside of your knee. Outside of your knee, outside of your thigh. Feel, you will most likely sense this kind of little ropey sensation of the thick tendon of the bicep muscle. Palpate it from the outside, right hand on the outside of your right thigh, toward the crook of the knee. Feel if you can sense this ropey sensation all along here. And then slide your hand closer to the mid-thigh. Feel if you can still track it. Can you feel the continuity of that muscle? It's very easy to feel tendon because it's really like a rope. It feels quite tight often. But as we go to muscle belly, sometimes it's not as easy to sense it. Spend a little moment touching. And then start to find out where this muscle begins on your pelvis. If you look here, we have the seat bone. This is the place that you're sitting. The seat bone. Slide your right hand underneath your right buttock and feel the hardness. It has a round shape. See if you can feel that round shape of the pelvic, of the ischium, of the seat bone. On the inside, it looks like this. It's almost like a rocker. You're sitting on the rocker. It's not a flat surface. Can you feel it? If you move a little bit forward and back on your chair, lean a little bit forward, lean a little bit back, you will sense how your weight is shifting over your seat bone. And that's where all hamstring muscles, except for that short head of the bicep, they attach here on that seat bone. And then go back to feeling the whole length from the seat bone, track it on the outside of the back of the thigh, downward toward your knee. Feel this whole length from the seat bone to below your knee. This whole shape. Now touch the same on the left side. And feel your left hand on the outside of your left knee, below, on the back of your thigh, and touch it. Watch whether you can appreciate that maybe one side feels a little harder. Most of us have some asymmetry between our right and left hamstring. Feel it from the outside and run your hands slowly down, 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 and up toward your left seat bone. We want to really, these 21 days, to get to know our hamstrings, not only from intellectual part, but actually really, really befriend them. Go to your seat bone with your left hand, sit on your hand, feel this hardness of the rocker. If you want to sit upright, you need to find out them sitting tall over the very lowest position of the rocker. That will give you vertical pelvis position, and that's a foundation of sitting tall. Wonderful. Now let's take a look at the inside. Go back to your right leg, but touch the inside of your hamstring, inside of your knee. I'll pull that. picture again. And now we'll be touching these structures here. I need to make it move. And run it. Run your hands on the inside back behind of your thigh. Feel how hamstring splits. One that goes toward the outside, one that goes toward the inside. And touch it. Feel how ropey the situation is here. Would you say that is more ropey than outside, or about the same tightness or less? Compare it. Right hand on the outside hamstring, left hand on the inside below the knee, and touch those cables, those ropes of tendons of your hamstrings. Underneath this is the third hamstring, the semimembranosus. But I don't think you need to be able to sense with your fingers the difference between one and the other. As long as you're on the inside, you are touching one of them. Interesting thing is that inside hamstrings, actually, they go and they attach on the front of your shin. So they wrap behind and they come to the front. So I move that to the knee. This is the front of your shin here. Good. Take a moment to feel the same on your left leg, the inside of your left hamstring. And don't forget about your seat bone. That inside is also attaching on the seat bone. So touch close to your knee. Run your hands on the inside back of your thigh. And gradually coming toward the seat bone. Feel if you can see the seat bone. And compare one hand on the inside, one hand on the outside. Feel what's the situation on the left side. Good, let go. Rest a moment. Let me show you something else on this beautiful anatomy app. Feel that hamstrings affect your knee joint. If you look at this small motion, how hamstring muscles rotate your shin bone. So let's first get a good view, maybe like that, maybe here, front, good. So, and let's make it larger so we can all see how your shin bone, this long bone here, can turn. So hamstring muscle can turn. Look at how the shin at the end of this movement, can you see the shin is turning outward when this muscle on the outside bicep pulls the outside of your shin and little fibula, the whole knee twist. You can see how important that mechanics might be if there is either too much movement there or not movement enough. So this is when that outside bicep, like how will we know that? While you're sitting, sit with your feet pointing straight forward and begin to do the windshield wiper movement with your right foot. turning, not the hip, not the thigh, but below. Just as if you imagine you have sand underneath the ball of the foot and you want that sand to spread it a little bit out and in, or you painting a little arc with the ball of the foot, turning it a little bit out and in. Touch with your right hand outside the knee, behind the knee. Some of you, I see you're doing it with your leg long. That wouldn't work because with the leg long, it won't be as clear. Bend the knee, touch with the right hand behind your knee on the hamstring on the outside, and do the windshield wiper movement out. Can you feel how it kicks in, how that muscle tightens up? When your right foot turns out to the right outside hamstring contracts. Now, put your left hand on the inside right and feel when you turn the foot inward, it's the opposite movement, twisting of the shin inward. It's called internal rotation of the knee. Often we don't recognize that the knee rotates. It doesn't only work like a hinge, straightening and bending. It has a little bit of rotational movement. Can you feel it? And now right hand on the outside, left hand on the inside, and pivot your foot very gently right and left, and feel how your hamstring muscles alternate, contracting on the outside, contracting on the inside. So often you will find that there is a dominance of one. One is pulling so hard all the time. And that might be the reason why the foot is pivoting and always too much of the out-toeing or in-toeing. Of course, there are different reasons too, like position and structure of the hip joint. Good, let's do it on the other side, on the left side. Start turning your left foot. Small movement, 5-10 degrees. You don't have to do a big twisting, especially people who have problems with menisci. Your hamstring, actually, some of the hamstrings attach to meniscus. So it pulls, it tugs a little bit on your meniscus. Feel you turning the left foot to the left, back to the left, back. And as you're doing it, can you feel that outside hamstring contracting? And now turn in your foot, your left foot going in, and feel on the inside how the muscle tonifies. Alternate, going right and left. Interesting, right? So it's not only the bending of the knee, but also the rotation. Beautiful. Stand up. Let's walk a little bit. Come up on your feet. Walk around, loosen up. And please remain muted throughout the session so I don't have to mute you. At the end of the session, we will have questions and answers, and then I'll ask you to unmute your microphone. But for now, it will pick up and all the rest of the group will hear your noise. So, great. Come back to sitting. And now let's take a look at a little bit more of our theory anatomy. I always use these sources, Complete Anatomy app. The anatomy that you saw is from that. I use it every day. And I often refer to the wonderful book by Dr. Donald Newman, Kinesiology of Musculoskeletal System. So from that book, let's take a look at the other end, because up till now, we were talking about how hamstrings bend the knee. What happens? Yes, when they contract, they bend the knee. They need to elongate when we straighten the knee. But you can think of the opposite end of hamstring, meaning your seat bone, moving toward the knee and away from the knee, right? When you stand upright, that seat bone is as close to the heel as possible here. When you're bending forward, the seat bone is moving north to the sky. So here you have a toe touch test, very classic test for assessing flexibility and mobility of the spine. Here in the situation, the far left, A is what they call normal lumbar and hip relationship. You see pelvis tilting forward quite a lot, about 80 degrees, and then spine moving too. Here, you have somebody in part B in the center of the screen. You see somebody who has short hamstrings, somebody who is not allowing. You can see your seat bones do not lift up. Compare A picture on the left, how far that seat bone went up, comparing to this. This is practically almost like the person standing upright. So therefore, bending here is done through a lot of movement in the spine. That could be dangerous for the back, especially if you have problems, spinal problems. Not having enough elasticity, flexibility, and control of hamstrings will be problematic. So here, point B is where hamstrings are short. They do not allow the seat bone to lift up. Here, you have somebody who predominantly bends forward from the lengthening of the hamstrings. You see practically no movement in the spine, very little bending. Compare bending here on the left to bending here. This is pretty much vertical spine, straight spine. So entire movement is done by pelvis tilting forward. That requires super long hamstrings. So let's do this movement. Let's see if we can recognize that. Come to standing, please. And put your hands, maybe right hand, on your seat bone. Palpate your seat bone. Reach behind your buttock, the place that you were sitting on. Now, it's not going to be as easy to feel it because your thigh is straight down and all the muscles are in the neighborhood. But you still try with your hand, find the shape of the seat bone that is pointing down toward the floor, pointing toward your heels. Can you feel it? And now begin to bend forward. Lean your pelvis forward. Can you feel that bone lifting up? And then go back to upright. Don't try to touch the toes. Don't try to make a major movement. Make it small. You're going forward with your torso. Think of washing hands. Think of leaning to the sink, washing dishes, vacuuming. You need to lean, unless you're not very tall, you most likely need to lean forward when you're vacuuming. How do you do that? Does the seat bone move up? Try the same on the left. Palpate your left one. For now, don't bother thinking whether you should arch the back or bend the back, whatever you do naturally. Lean a little forward and watch how your seat bones lift up. Which brings us to another interesting point, because many people think of hamstrings as their main problem is just tightness, that they are short. But hamstrings need to be both. They need to be able to lengthen, to allow movement, but they need to work. Look, when you're bending forward like this, your hamstring muscles are controlling so you don't drop down. If you didn't have hamstrings, you would fall. You would fold yourself, right? Touch your hamstrings and feel, can you sense they're getting more contracted as you lean forward, controlling that movement? Sometimes weakness of these muscles or lack of endurance will make us cheat. Like we jut the hip out to the side when we're trying to reach down, or we are moving only from the spine. We are rounded, our kyphosis in the middle back, because the hamstrings don't have the energy, or they're not used to be used for leaning forward. And further you lean forward, more of the hamstring you need. At the beginning, it's your buttocks. Put your hands on the buttocks. Place your hands on the buttocks and feel when you're making this kind of forward lean, a small amount, can you feel your buttocks contracting? Early on, you contract the buttocks. As you progress with more and more forward lean, you will feel the work shifting from the buttocks to the hamstrings. Palpate once your buttocks, once your hamstrings, and see if you can feel they need to get longer. If they don't, if they are ropey and they fix your position of the pelvis, of course, the pelvis is not going to go anymore. That's it. But they also need to be strong to prevent falling forward. And for people who are hyper flexible, that is super important. How to learn to tonify them, to contract properly. Now let's do it. Let's see if we can discover maybe our pattern. Right hand on the buttock, right buttock, left hand on the hamstring. And lean forward. And as you're going forward, feel what kicks in first. Is it your right buttock? Is it your left hamstring? At which point hamstring takes over? At which point is buttock mostly preventing you from folding? If you were a ragdoll, you would fold, right? You would just collapse forward. So something is not allowing you to collapse. Something is bringing you back. Something is stopping you. If you're washing dishes, you don't want to collapse to 90 degrees, right? That's not useful. You need just a few degrees of leaning. What stops that? Switch hands. Left hand on the buttock, right hand on the hamstring, and see, is it a mirror image, or would you find there is a difference between right and left? Great. Come back to the screen, sit down. Let's take a look on another slide, which is a version of toe touching. Here we go. So this is what you just did. Now, bending forward in sitting. And for many of us, we have hard time sitting upright. Like sitting with legs long requires your hamstrings to get longer. Why? Because this seat bone need to be able to move back as you're being upright or even as you lean forward. If the seat bone is not, it's held closer to the knee, you are in the situation of little of a slouching. Pelvis is tilted back and you have a hard time of being upright. So how will we test if we have good enough length, if we need to focus in the next 21 days on lengthening them, or should we focus more on strengthening them? Let me show you a very quick, simple movie of how to test it. So here is the example of me sitting rounded, right? Me having, you can imagine seat bone here is pulled little bit somewhere toward the knee. That creates the tilt of the pelvis back and therefore slouch, roundness of the back. So how to test flexibility of hamstrings and also how to differentiate, because it's important to be able to differentiate between hamstrings and sciatic nerve. So let's see hamstrings first. Toe touch. You standing, bring your feet closer together, be upright, and bend forward, reaching, see how close to the floor you get. If you touch the toes, you probably flexibility is just fine if you're doing normal things, except for if you are a gymnast or you need to do sports. Do it second time as you exhale, creating relaxation, like taking breath in and Releasing. See if you can get a little closer. So that's the first step, toe touch. Second is straight leg raise. For that, you need a yoga strap or even just a simple scarf. Put it on the ball of the foot. A few times, maybe warm up, having the opposite leg straight on the floor, and then you warm up 2-3 times by bringing the leg a little closer to you and back, bringing the leg closer to you and back. And then we do the actual test, which is both legs are straight, and then you bringing it up. I would recommend setting a video. If somebody can watch you, great. If not, set a video camera, and even your phone can help you set the video and take a screenshot or a shot from the side and see if you get to about 80 degrees. So if I stop that, about 80 degrees of angle between the pelvis and the leg and the thigh would be ideal. In my case, there is a little bit of bending of the knee so that the knee is not fully straight, which means that somewhere here, the distal hamstrings might be tiny bit on the short side here. So using the telephone is a wonderful, wonderful tool where you can do it on your own. The third part is to check how comfortable you are in sitting position, in sitting upright. Can you be upright comfortably with the pelvis reasonably upright? See what happens when you bend your knees, if you can lean more forward. Many of us have the trouble like that. The hamstring is short and it makes the pelvis lean back. And therefore, we need to sit with either knees bent or avoid the position altogether. All right, why don't we do these 3 simple tests? And I would encourage you to take the phone, not right now, but as you're starting today is day 1 of our program, do a video of yourself before and after. So you can see, you can be motivated to see how you're changing from week 1 to week 2 to week 3 as we progress. So first one, standing, stand upright. Bring both feet together, close, your knees straight or reasonably straight. If they're always slightly bent, well, let them be. And go ahead and bend forward as if to touch the toes. Don't force, don't be forceful. See what you can do within your limits today. How far from the floor are you? Are you a foot off the floor? Are you touching the floor? Then come back. Do the second touch with exhalation first. Take a deep breath in and exhale, relaxing as you lean forward and bend forward. And feel how close or how far from the floor you get today. It'd be wonderful to document. If you can, do this test while videotaping yourself on day 1. Come back. Second test, come to sitting. Sit on the floor. And sit with legs long. Pay attention how easy or impossible this is for you. Some of you can sit almost like L. Some of you are like very flexible and like dancer or yoga people, gymnasts can fold practically like jackknife, kiss the knees, which will mean very, very long hamstrings. Unless you're a gymnast or you need to do yoga or martial arts or some other sports, 80 degrees is all that you need for everyday life. Feel how easy it is for you to sit like that. Bend your knees slightly and feel when you bend your knees, your pelvis can tilt a little bit more forward. Most likely you can come a little bit more forward or upright. Now straighten your knees and feel, can you stay upright or does it push you back? Check this. And the third one was with a scarf or with a yoga strap, but just to get the gist of it, if you don't have the yoga strap, that's okay. Lie on the back. If you have a yoga strap or scarf, bring it. And warm up a little bit by hooking the strap on the ball of the foot. If you don't have it, you just lift the leg up in the air and then come back down. And do this a couple of times. Lift the leg, return, lift the leg, return, and see if you get to 80 degrees of straightness. If you do, I do not encourage more stretching. Stretching, you will have it covered. Then we need to work on proper concentric, isometric, eccentric strength, endurance, the new patterns of movement, rather than elongating to the limit, because too much movement actually puts pressure on structures like your hip joints. Feel some of you will have the knee that is impossible to straighten. So feel with straight knee, how far can you get? Some of you will get to 30, 40, 50 degrees before the knee has to bend. So to check that flexibility at the get-go, keep your knee straight. Do the same on the other side. Observe your sense. A few times, and don't be too aggressive, because it's so easy to pull something, to strain something. We don't need that. Beautiful. And then come back, please. Now, let's spend a moment, because this is quite important. Come to the screen for a second. Sciatic nerve, because a lot of people may have difficulty with stuff like forward bending, with straightening the knee fully, not because of hamstrings, but maybe from some impingement on the sciatic nerve. So if we look on the anatomy up again, here I brought you a picture of a sciatic nerve. It's not complete because it actually, let's see, maybe we can do better than that. Let me undo. Let me undo again. So here we have the skeleton. And if we dress it up with muscles, let's dress it up. Now you're starting to see hamstrings in the back, these muscles that you were already touching on the inside, on the outside. Now let's put some nerves. And now maybe we'll strip. Oh, that's nice. So here is a picture of, let's see, how many layers do I need to remove so we don't have too much noise. Great. This is your sciatic nerves. The sciatic nerves that runs from underneath the sacrum. If you look at if we turn it to the front, you will see that the sciatic nerve runs from the lumbar spine. There are branches. You see how, for some reason I cannot, okay, here. You have sciatic nerve, which is really super big cord. Look how huge it is. It's not a tiny thing. Often when we think of neurons, we think of very small, very tiny things that you need microscope to see. But this is a neuron, a huge cable that runs on the back. It goes from behind your sacrum and it runs down. So when we do straight leg raises, we are actually stretching this nerve too. So let's look, how will we know if the difficulty you might have is coming from the sciatic nerve irritation or from short hamstring or pulled hamstring? There's something called slump test. And what you look for is when it's the sciatic nerve that's problematic, you will have either sharp pain going down the leg all the way to the foot or in the back of the leg. The distribution may vary, but pain in the lower extremity, that would be one sign. The other sign will be tingling or numbness. If you do that test and you start to feel your foot is getting numb, that may suggest that the trouble is actually within the sciatic nerve more than your hamstring muscles. So let's keep going with this. So here we're sitting. Now we will do the slump test. You sit tall, your knees are in front of you, not more open or not closed, and you will do it in 3 stages. First, you'll straighten your knee and bend it and see how straight can you make that movement. Of course, your hamstrings need to get longer in order to do that. Now, to differentiate between limitations in this movement from hamstrings or sciatic nerve, we can do this slump test. We'll put hands behind the back. We're going to slouch. We're going to stretch the spinal cord, collapsing in the chest. Then we will bring chin to chest, which is even more putting stretch on the nerves. And then you will straighten your leg and you will flex your ankle. If you get pains in any of those stages, let me repeat it first, one more time. If you get pain, like numbness or tingling, when you do just the first point, don't stretch it even more. That's enough. If you feel that this triggers huge pain down the leg, or you chin to chest, you stretching spinal cord, that means that the sciatic nerve gets pulled. Here is the maximum pull on it. When I do this, let me stop here, dorsiflexion of the foot. You can imagine from the brain through the spinal cord, all these nerves running through what we saw with the pink highlighted on Anatomy app, behind all the way to the heel. I'm putting this big stretch on the sciatic nerve. If you don't have any troubles with this, no sciatic nerve irritation, no tingling, numbness, but the limitation is only in straightening the knee, it's likely that it's actually hamstrings muscles that limit the problem. Sometimes I vary this test to see if the person gets better, if I can see a difference between slumping. I'll repeat it here. I slumped, I slouch, I bring chin to chest, I extend the knee. And let's say my client tells me I get pain. Then extend the neck and see if the pain is lessening. That will be another way of suggesting that it is a sciatic nerve. Shall we try? Come up to sitting. Because the management of sciatic irritation is quite different. Like I wouldn't encourage anybody with irritated sciatic nerve to do some big stretches. If that, consult with your doctor, consult with whoever you're working on the musculoskeletal system to see whether to proceed with exercises. So what do we do? Straighten your knee a couple of times, see how easy it is. Some of you will have no problem straightening fully your knee. And don't sit on the front edge, sit actually further back so your whole thigh is supported by the bed or chair, and straighten your right knee. Feel how straight does it get? Do you get full extension? Observe what happens with your seat bones. If hamstrings are tight, you will feel that you're collapsing back a little bit. The pelvis tilts backward. In other words, you're starting to slouch a little bit. Now, if you get some tingling or pain sensation down the leg, let's see, bend the knee, First, bring both hands behind your back. Clasp your hands behind you. Slouch, round yourself. Collapse your chest a little bit, get into slouch position. First with the neck looking straight forward, eyes looking straight forward. Feel, what's that like? If that triggers numbness, tingling, don't proceed any further. That's enough. Then bring your chin down, chin to chest. We elongate your nerves a little bit more. If that produces, don't proceed any further. Then straighten your right knee and flex your ankle. If there is no tingling numbness, if there is no sharp pains, electric pains going down the leg, you don't need to worry about sciatic nerve involvement. It's not likely to be involved. Do the same on the left side. First, sitting upright, straighten your left knee a couple of times. Feel how close to full straightness you get. And then slump, observe. Clasp your hands behind you, slump forward, observe what's your sensation in the leg, in the thigh, back of the thigh, if you feel comfortable or not. Then chin to chest, adding a degree of stretch. Finally, straighten your knee in this position while the chin is down when you've slouched. And flex your ankle. And in fact, for those of you who don't have sciatic problem, but problem is more of the shortness of hamstrings, the moment you slump, you will feel that your knee can actually straighten better. Did you notice that? That with a slouch, your knee may straighten better. Compare that to being upright. Don't allow yourself to stretch and straighten the knee. This requires length in hamstring muscles. Can you feel that? And then go ahead, slump and see if the knee straightens easier. If it gets easier, if you don't have any neurological symptoms, electric shocks or numbness, tingling stuff, most likely the reason is hamstrings. Of course, fascia can contribute to it too. When you're slouching, you're pulling not only your nerves, but fascia, muscles of your back. So it gets a little bit more complex. Come up to sitting. And come up to standing, please. Walk around, loosen up. Notice your hamstrings play an important role in swinging of the leg. They stop the leg from uncontrollably swinging forward. They decelerate swing of the leg as you're walking forward. If you look, sometimes people have a little bit of a snappy kick of the leg. That may suggest the hamstring is not working properly. Many athletes who, when running over stride, they put excessive stretch on the distal part of the hamstring muscles, and that makes them prone to injuries. They can increase risk. Another risk factor is the pelvis that is excessively tilted forward, meaning the seat bones are moved away. That also overstretches if the person is a runner or sprinter and the pelvis is an excessive anterior tilt. That would suggest increased risk of hamstring pulls, hamstring injuries. Great. All right, now let's do the first approximation. So now will be an actual lesson, your first lesson.